Day weekend. I hope everybody has great plans. So today we will be led by our fearless coalition manager, Shanae, in a regrounding, going over our problem statement, the evidence and strategic focus, and a final review of our action plan before AJ then leads us in community announcements and upcoming meetings. He will also cover this, but the in-person meeting is always a really great time. I hope to see many of you there. If it's in the same place that it usually is, I love that building. It's very beautiful, set back in the woods, and it's just always a great time to get together and have the opportunity to discuss through our agenda items and our coalition strategic framework and future direction all together. I think those in-person discussions, while the virtual is a great solution to keep us intact, I think those in-person discussions really take us far. So I hope many of you can join us. And with that, I will turn it back to Shanae.
Thank you, Nina. And for those who are just joining us, if you don't mind adding your name in the chat so we know you're here, we'd appreciate that very, very much. Thank you for that warm welcome, Nina. All right, in similar fashion, we're going to go ahead and start with our regrounding. As you know, I always like to do this, and this will be the final time we do this. So I'll share the problem statement and the data that helped guide this work. In the problem statement that was selected by our CHIP steering committee, it highlights that rates of depression, anxiety, and substance use are rising among county residents, especially our youth and young adults. And so we looked at the community health assessment, read that, checked the data, and it really just emphasized that nearly half of all residents report experiencing poor mental health days, which really truly does underscore the need for stronger prevention, earlier intervention, and expanded access to services. And so after we looked at that data, we had some root cause analysis discussions, and as a work group, we identified one strong starting point to kind of help guide some of our brainstorming discussions. And the group as a whole selected workforce capacity and support, specifically how we want to strengthen the availability and the diversity of the behavioral health workforce. And then from there, we discussed what success could look like over the next 3 years, because again, our Community Health Improvement Plan, or our CHIP, is a 3-year cycle. And in those discussions, we identified some common themes, such as care coordination, collaboration, and ways that we can creatively expand workforce support. And so these themes helped to guide the development of our goals as well as our objectives. And then we did some voting to prioritize which goal and objectives we wanted to focus on for the CHIP. And so that brings us to where we are today. The goal we landed on was to increase behavioral health literacy, navigation, and access to centralized resources. And at its core, this goal is really just about helping residents better understand that behavioral and mental health, like know where to go for support, and ways that they can feel more confident navigating those available services and resources, because we know there's so many out there, and we're hearing from residents that it can be a little overwhelming trying to figure out which source they can trust and where they should start. And so based on the conversations and the feedback from this work group, we drafted 2 proposed SMART objectives that center around improving awareness of available resources, strengthening navigation and that connection to care, as well as an objective that focused on building community capacity through behavioral health training. We specifically identified that mental health first aid training, so that way more people are equipped to recognize needs early on and better connect others to the appropriate support and services. And so one thing that came up consistently throughout our discussions was that, improving behavioral health awareness, prevention, and access, it does require more than just offering those services, right? It also requires that trust, reduce stigma, things like community awareness, education, culturally responsive communication, responsive support, strong community partnerships. We talked a lot about cross-sector collaboration and how we can all be streamlined in our efforts to promote those clear pathways for navigation, referrals, follow-up care. And then that increased community capacity to recognize and respond to behavioral health needs as well. And so you'll see a lot of those themes kind of reflected throughout the proposed action steps that you all helped us come up with. And so that brings us to today. We're in this final review of the action plan. So last month we talked about all the different action steps, the objectives, the goals. We got some feedback, and we integrated your feedback and kind of retweaked some things. And so we want to present these this action plan to you one final time to get your last bit of input, because that's it after this. And so yeah, before we do that, I always just think it's so important to just express my gratitude to everyone, again, just for the time and expertise and perspective that you all have brought throughout this process. Over the course of our meetings, we've had really thoughtful conversations around everything from behavioral health awareness and access, resource navigation, coordination, addressing barriers, behavioral health education, literacy, long-term workforce and training capacity. We talked about all the things, right? And so your feedback really did help us shape the direction of this work. And so today, like I said, is really just intended to serve as more of that final review and validation of the proposed action steps that were tied to the goals and objectives that we selected together. So I really hope that today, again, we'll walk through these strategies one more time. And as we walk through them, I want you all to consider, do they still feel aligned with the priorities that we identified? Do they feel realistic? Do they feel actionable? And then I really want to make sure that I get your feedback on partners. We talked loosely about that, but I just want to make sure that we've identified, in the general sense, the right partners to support the implementation of each strategy area. So with that, we can go ahead and get started and walk through these action steps together. And so instead of presenting it as that big table that we shared last month, we wanted to present it in a way that's a little bit more palatable. So we'll start with objective 1.1, which states that by June of 29, we're aiming to increase the percentage of county residents living in high needs communities who report knowing where to access behavioral health and social services. And so overall, this objective is really centered around improving behavioral health literacy, strengthening
that. Sending you a message.
Oh,
It was thank you for.
Dr. Wiggum, you're not on mute.
I'll mute her for you. There you go. So we're focusing on behavioral health literacy, strengthening navigation support, and making sure residents know where and how to seek help when they need it. And so this first strategy area focuses on accessing behavioral health awareness, access and navigation gaps. I got to tweak that language there. But one thing that this group emphasized early on was that before we can even improve access, we first need a clear understanding of where the biggest gaps and where the biggest barriers currently exist across this county. And so these action steps really focus on ways to engage residents and partners through, whether that's through surveys or listening sessions, focus groups, and other broader community engagement efforts to try to better understand awareness of behavioral health resources, challenges with navigating systems, barriers to care, and differences in experiences across communities. And now I know this is something that is currently being done with some of our partners, and so we wanted to make sure, again, that this work was not duplicative. So we did include language around leveraging some of those existing data resources that are already available. So whether that's through the county, the schools, healthcare providers, community partners, wherever we can, whenever possible. And overall, this strategy area is really just about building that stronger understanding of community needs. So future outreach, future navigation, and future resource coordination efforts can be a bit more targeted and more effective moving forward. And so I'll stop here for a moment. Any final feedback on this section? And this is just a snapshot. But yeah, any final feedback? Are there any additional partners or data sources we should be considering? I know we talked about like the YRPS, we talked about data, a PGC help zone, but open to feedback.
Um, the one question I have, because I kind of work in a little bit in the data area, is how will you measure that there's 15% more awareness? I mean, is there some metric you're looking at? I mean, that might be the only.
Yep. So that's something that we kind of talked about internally, is like looking at the existing data, and if we don't have that clear data metric, then is it that we take this first year of the chip to gather that information? And so we can be flexible in this approach, but we wanted to see what existed first before we did anything else.
Yeah, I mean, my only suggestion would be to find like some metric that would be your benchmark, because I don't, I guess in saying you have numerous ones, it's hard to know if you're successful or not. So that's my only suggestion there.
Okay, perfect. I'm noting that now. Thank you, Larry.
I had kind of a comment to add off of that too.
Sure.
Just if we don't have the benchmark or like metric, the 15%, it might be hard to really know what that looks like if we don't know what we're kind of starting at. So understanding if 15% is kind of feasible. I was just wondering where we got the 15 from if we don't have the benchmark.
Yeah,
Or
so
if it's
looking,
something we're going to work on, you know.
yeah, so great question. Yeah. And so that was something that, again, we were hoping to either find the data that already existed, or if it didn't, using this first year to gather that information. And then in years 2 and 3, measure to see if we can reach that 15%, that 15% increase. So our baseline would essentially be 0 in the first year. But if that doesn't seem feasible, if that seems kind of far-fetched, like I'm open to suggestions. So this is the time for that. Does 15% seem realistic if we had to start from scratch?
I think from my perspective, just like with like the FE and data work I've done in the past, I think it's hard to know if the 15% is appropriate without having the data kind of there to bounce off of. And then also understanding who is high needs, like if this is just like a subpopulation as well. Is it people by like a certain zip code? I know that, apologies if that's already been kind of over too. So, or we've gone over that already, but.
No apologies needed. Yeah, we did talk about looking at some of the census tract data to identify what those high need populations would be. Any other comments or thoughts? And if it's okay, I'd love to follow up with you both to kind of have a little bit deeper conversation about the data, if that's okay.
Happy to, definitely.
Yeah, I mean, I don't want to belabor this, but I think you'd have to contract with some kind of survey company to get a baseline on what percentage in those area codes actually do have awareness, and then do a post survey to figure out if you've increased awareness. I mean, that I guess would be a scientific way to do it.
Yep. Perfect.
And then also too, just kind of understanding, would it be like a convenient sample? Is it something we could lean on the community health assessment? Like something you've already, captured. Just because it can be hard to get a representative sample. That would require a lot of resources.
Yes, it would. Okay. I'm writing all your comments down. Thank you for that. Well, with that, let's go ahead and move on to the second strategy area. And this focuses on expanding and strengthening the use of a centralized navigation platform. And so one theme that also came up pretty consistently in some of our conversations was just how difficult and how fragmented just health and social service systems can be as a whole, how they can feel kind of fragmented for residents, even though resources exist. And so these action steps centered around trying to strengthen and promote findhelp.org specifically as a centralized resource hub for those behavioral health as well as social services across Prince George's County. And this was something you all brought up. This Find Help was, again, another resource that was brought up actually with all of our work groups. And so this was something that is incorporated in each work group's action plan. And so there might be some overlap and some partnership opportunities there. But some of the key activities here include supporting just those regular updates to service listings, finding ways to expand outreach and those promotion efforts so people know what Find Help is, how they can use it, and then helping organizations integrate that platform into their workflows for things like referrals, for intake, for care coordination, for follow-up support. Another major focus here is training and technical assistance. I know with every new thing, you have to have that learning curve. And so being able to work with Find Help to provide that training, to provide the technical assistance. So our coalition partners, what youth serving organizations, maybe there's other providers, the schools, they all feel comfortable using and promoting this platform more consistently. And so similar to other sections, we just don't want to measure the participation in these trainings. We want to understand whether or not residents and providers are actually using this platform in a more effective way over time. And so overall, like I said, the goal here is really just about creating a more connected and easier to navigate system where residents and providers can also access those behavioral health and social services through that one trusted entry point. And so, yeah, I'll leave it there. Any thoughts, recommendations on this strategy before we move forward?
And I just had one question, and
Sure.
it was just something that I had been working on recently. Is there a reason why we did Find Help versus 211 Maryland?
So there was, yeah, so that was just a conversation that's one of the resources that came up in conversation. Now, this doesn't mean just because the action plan focuses on Find Help doesn't mean that we can't also promote 211. That's a resource that exists. Many people are familiar with that. So it's not to say we're doing one or the other. It's just for the purpose of this chip. Some of these action steps are just specific to findhelp.org.
Thank you. Yeah, because I just was realizing that, 211 is the Maryland Information Exchange. So it's like, I think as counties try to form it, if there's a lot of support for 211 Maryland as the information network, if we're going to not be fragmented, just a thought about that.
Thank you for that comment. Any partners kind of want to give additional input on whether, I don't know if you've used one or the other or both, but any feedback on, resident user experience using either or just, organizational experience using either or? Is there a preference? Okay. All right. Well, hearing none, we'll go ahead and move on to our third strategy area. And this final strategy under our first objective focuses on specifically expanding youth-centered behavioral health literacy and navigation supports. And so throughout some of our discussions, this group strongly emphasized the importance of engaging the youth directly and ensuring that behavioral health messaging is youth-friendly, that it's culturally responsive, as well as stigma reducing. And so some of these action steps really focus on being intentional about our partnership with youth and youth serving organizations to co-create educational materials. We talked about co-creation of social media campaigns, working with county-based social media influencers, outreach messaging, navigation support that are all relevant and accessible for young people. We also included potentially utilizing some of those youth engagement strategies. So listening sessions, focus groups, maybe there's some youth advisory council opportunities so that way youth voices can continue shaping our outreach and our engagement strategies over time. And this is something that we talked about would kind of help build that trust with our youth in the community. And then most importantly, I think this strategy area recognizes that barriers for youth often go beyond awareness alone, right? We know that other barriers that exist include stigma, the mistrust, confidentiality concerns. We talked about cost. And so the goal is not just to increase information, but really building that trust and creating messaging that resonates with young people in ways that they understand, that they resonate with, and that encourages that support seeking and connection to services. And so we're hoping that, with these strategies, we'll see that increased behavioral health literacy among this population, that we see stronger youth engagement, as well as greater awareness of those available resources for our youth. So does this still feel aligned with the direction that the group wants to take? And Jennifer, I see your comment.
I would say yes. And at the risk of being a bit nitpicky,
Sure.
I know during this discussion in regards to partners, we talked about juvenile justice partners, or even in the child welfare or foster care. And I know that they may be captured in the youth serving organizations and providers, but I think there may be some value in explicitly naming those, because they're often forgotten about when thinking about, youth organizations, and we may, so just wanted to put that in the conversation.
Awesome. Thank you. We'll be sure to include those on our partner list. Any other comments or thoughts? Any other partners or populations we should be considering?
Sinead, I was just thinking about any existing youth advisory boards that might be out there. I don't know if that'll fall under your coalition partners, but just to be explicit, since there are a few out there in the county.
Perfect. By chance, do you know what those are offhand, or?
There are a couple. I know there's one in tobacco. I think there is something actually stated as youth advisory board. I could look some of them up and send them your
That would
way.
be great. Yes, please. Perfect. Thank you all so much. This is very helpful. Any other thoughts or feedback before we move on to our second objective? Awesome. Okay. All right, so moving on to objective 1.2, this objective shifts more towards building community capacity to recognize and respond to behavioral health needs early. And so by June of 2029, we were aiming to train at least 450 county residents, community leaders, or frontline staff in mental health first aid, youth mental health first aid, teen mental health first aid, and other related behavioral health trainings. I think in the last month we talked about QPR, question, persuade, and refer. Did I get that right? As an additional training that we could consider as well. So open to other options, but as a group, we wanted to highlight mental health first aid. And so that's what this strategy really focuses on. And so one thing that this work group highlighted quite often was that, schools, families, community organizations, frontline staff, they're often the first to notice when a young person may be struggling, but many people don't always feel equipped to respond appropriately. And so these action steps focus on expanding that accessible, that cultural responsive, that low cost free behavioral health trainings in those high need communities. And so we also intentionally identified a broad range of sectors for engagement. So we talked about including the educators, we talked about parents and caregivers. There was conversation around law enforcement. Getting those faith-based organizations involved, again, the healthcare providers, nonprofits, youth-serving organizations. We know there's a lot that exists out here, and so we want to make sure that we can get as many people trained as possible. So wherever a youth or young adult comes into contact with someone and they may need help, that someone is able to respond and get them connected to care appropriately. And we know that that requires that community-wide response. And so, again, the measures here, we're not just focusing on the numbers of trainings that are conducted, but we want to make sure that we highlight that participation across sectors. And so, yeah, this section really just reflects the group's emphasis on, finding ways to reduce the stigma, strengthening that early intervention, and then improving those connections to care before a crisis escalates. And so that will be our first strategy area. Dr. Blunt, I think I see your hand.
Yes, I was not around for this particular conversation, so I just have a question about the selection of mental health first aid as the curriculum, given some of the critique around the cultural competency, I guess, of the program, and also the fact that we are in a behavioral health shortage, and so if folks are referring and the workforce is already limited, then it may deepen some of the issues that we're trying to resolve. So just wondering if there was any dialogue around those components when selecting the mental health first aid curriculum.
That's a great question. Yeah, that's a great question. I have to is it okay if I get back to you on that one?
Yes.
Okay. I'll put a note here to follow up with you.
Okay.
I don't know if anyone else is on the call that was a part of that meeting. Sorry, guys, my afternoon brain is kicking in. If anyone else was on that meeting and can speak to that, that would be great. I know one of the things we talked about was I forget what organization it was. I think it was Everymind, but they were talking about how they are trying to offer that to more partners in Spanish. That wasn't something that was offered, I guess, frequently, and so trying to build the capacity for that bilingual training. And utilizing like CHWs, patient navigators, case managers to help with that like train the trainer type of curriculum. But I'm happy to follow up with you a bit more on that, Dr. Blunt.
Okay, thank you.
Sure. Any other feedback, comments?
Just a similar question, if we had a benchmark for how many residents are currently being trained, and if in order to track this, what would the reporting needs be and how folks report, and just maybe a little more clarity on what types of trainings are included. For instance, we do like naloxone trainings and ERPO trainings, so just knowing like kind of the reporting structure and the data behind it.
Yep. So I know that some of the organizations that offer this training already track that. So it would just be a matter of following up with them to get those numbers for this past year, whatever we want that benchmark to be. And then you said what other trainings are included. We talked about some other trainings. And again, this action plan is flexible. So if, we're in the process of planning for implementation and we decide mental health first aid maybe isn't the direction we want to go, and we want to go with QPR, we want to go with naloxone, like the great thing about this chip is that it is a fluid document and we can do with it as we please. And so naloxone wasn't initially brought up, but I think that would be a great training to include, especially with the rates of substance misuse and things like that. And then the increase in that with our youth, I'd be open to that. I think that'd be a fantastic idea too. So yeah, so again, this is a fluid document and we can move with the tides on this one.
Okay, thank you.
Sure. Are there any other trainings that we should be considering, particularly with our youth and young adults, other than naloxone or youth mental health first aid?
Shanae, one of the things I just wanted to bring up just for awareness in terms of the youth-related naloxone specific training, we're currently working in the background within the health department to try to ensure that we have written authorization to be able to provide this training to youth or anyone under the age of 18. So we're working on that and hopeful that we'll be able to do that in the future.
Great. That's fantastic, Denise.
Thank you, Denise. Yeah, I think for some of those trainings I mentioned, they would be, like adult audiences as well. But looking at the objective, it looks like they don't have to be, like, I guess the target is frontline staff more so and already community leaders. So I guess I'm just clarifying that we could include, there's no additional metrics around like county residents. That's like the only, I guess, eligibility to include them in this 450 count.
We can absolutely include them in this 450 count.
And I would add in terms of additional trainings, I think the World Health Organization has a lot of, trainings that they've developed that come from a human rights perspective as it relates to mental health. I do find in some of my own just research that the mental health first aid was adapted from an Australian context and adapted from an Australian context. And I think that for the level of diversity that we have within our county, some of the resources developed by the WHO may be more applicable to the needs because it comes from a human rights perspective and also helps with, advocacy, because we can't, if we, take a public health upstream approach to look at what's happening, we have to consider, just the climate as a whole. And I think that, some of the drawbacks of the mental health first aid piece is a lack of the full picture, and we know that the full picture matters for what folks are experiencing in our county.
Okay. So with all this feedback, I'll pose the question to you all. Do we want to pivot from mental health first aid to look more into something like naloxone training or something else? Like this is the time to do that, and I'd be open to that discussion.
I'm not necessarily suggesting a pivot. I just know I wasn't a part of the conversation, so I wanted to just add that in to see if it was just thought about. But if it's in mental health first aid, you know what I mean? Like that's okay. But I just want to add my voice. So I'm open, personally.
I hear you, Dr. Blunt. Thank you. I just want to make sure that we open the floor for that conversation if anyone else is thinking like that too. Again, this is open. And we know that there are lots of trainings out there. We want to make sure that we're considering and implementing the training that works best for our county, for the population of people that we're hoping to serve through this chip. Any other thoughts or feedback? Okay. All right, and moving on then to our final strategy area, which focuses on building training capacity and sustainability. one thing that this group discussed was the importance of making sure that this work continues beyond those short-term trainings or beyond those one-time initiatives. And so the action steps here really focus on trying to develop that longer-term behavioral health training infrastructure across the county through that train the trainer approach or the train the trainer model. And so this would include, whether that's recruiting, certifying those local mental health first aid instructors, building the stronger cross-sector partnerships, so that way we can sustain the ongoing training opportunities, whether that's within schools, other healthcare settings, community organizations, again, those faith-based organizations. And the hope was that over time, we help to create this larger network of trusted community members and organizations who are equipped to provide that behavioral health education and support. And so the outcomes that we're looking for here were centered around just that increased long-term training capacity, expanded access to those mental health first aid trainings across communities, and then that stronger countywide, I guess we'll call it behavioral health response infrastructure overall. And so as we look at this final section, does this still feel aligned with the vision and the priorities of the work group as it pertains to this CHIP? Open to any feedback or any additions, any other recommendations? Any other partners we should be considering? Okay. All right. Well, then we'll go ahead and move on.
I'm sorry. For
Oh.
partners, perhaps like chambers of commerce.
Chambers of Commerce?
So that, business owners in the community could be also trained, because they have influence and they have staff and they have, all types of things, people.
That. It's a great thought. Thank you.
Of course.
It's funny you mentioned, not funny, it's ironic that you mentioned that because we were just at an LHIC conference maybe 2 weeks ago, and the Chamber of Commerce was a partner that came up across multiple county LHICs as a partner that many people didn't even think to consider. And so I think it was Frederick County or Frederick Health Department, I can't remember, one of the health departments was like, oh yeah, we partner with them all the time. And we're just like, oh, like what a great, like everybody just had this like come to Jesus moment. It was fantastic. So so thank you for bringing that up. I really do appreciate that. And Denise, I see your comment regarding the youth related councils as well. So thank you. Awesome. All right. Okay, so yeah, so overall what we've outlined here really just reflects many of the priorities that this group identified from the beginning. And more importantly, I think these action steps really just reflect the collective input and the recommendations of this work group. And so again, today was really just about that final validation before we move into final CHIP documentation and publication. And so what I'll do is, again, I'll take the feedback that we got today, tweak a little bit more. I'll have some follow-up conversations. Claire, Larry, I think I said I'd follow up with you, specifically Dr. Blount. I think I might follow up with you, and Denise, I'll also follow up with you. And so what we'll do over the next month, we're actually going to pause our regular work group meeting in June. And so that's just so that, well, one, it's end of fiscal year, things are busy for everybody. And we know that like budget's ending and just it's a lot going on. So I think this would be just a great opportunity to just take a pause so that the coalition leadership can focus on drafting and finalizing this full CHIP document for July. And so and then we'll just focus June on that quarterly meeting, which we'll talk a little bit talk about a little bit more in a brief moment. But again, I do just want to seriously thank you all just for your partnership and your patience and your thoughtfulness throughout this process, because you've given us all lots of different perspectives to consider. But before we move on to talking about the quarterly meeting, I'm going to go ahead and turn it over to AJ to share a few community announcements. AJ?
Thank you. Suburban Hospital has shared their most recent Southern Maryland older adult resource newsletter, which includes a variety of upcoming and ongoing programs, resources, and events focused on safety, health, and wellness for older adults. This newsletter includes programming from Suburban Hospital, Johns Hopkins Medicine, Washington, Metro Oasis, and other community partners. I wanted to share this out with everyone after the meeting so that you can review it, pass it along to residents, clients, families, or anyone else who may benefit from these resources. Next announcement is for Brain Health for Every Generation, hosted in partnership with the Alzheimer's Association and Parks and Recreation. This event will take place on Saturday, May 23rd from 1 to 3 p.m. at Harmony Hall in Fort Washington, with a hybrid option also being available. The focus of this event is on reducing risk and building resilience at every age. It is family friendly and will bring together experts, neighbors, and community members to discuss practical ways to support brain health and better support individuals and families affected by Alzheimer's. If this is relevant to your work or community, please feel free to register or share. Next up, we have the 988 Deep Dive for Clinical Integration and Crisis Response. So Every Mind is hosting a virtual webinar. This will take place on Thursday, May 28th from 6 to 7 p.m. The webinar is geared toward healthcare professionals, behavioral health clinicians, care managers, social workers, nurses, emergency department professionals, and others involved in crisis response or care coordination. Participants will learn more about how to integrate 988 into clinical workflows, when to use 988 versus 911, and how to support referrals, risk assessment, and follow-up care. CME and CE credits are available, and the registration link is listed on the slide. Next, Prince George's County will be hosting the third annual Multicultural Festival on Saturday, May 30th, 2026 at Fairwood Community Park. This event is free and open to the public. The parade begins at 10:30 a.m. The festival activities will run from 12 p.m. to 6 p.m., full day events. This is a great opportunity for residents and families to come together and celebrate the diversity of cultures represented across Prince George's County. There will be live music performances, a very, very large kids zone, food vendors, art vendors, and other community activities. Please feel free to share within your networks. There will also be a re-entry housing resource fair on Friday, June 12th from 12 p.m. to 3 p.m. This will be held at the Bridge Center located at 5001 Silver Hill Road in Sweetland on the second floor. The fair will focus on re-entry friendly housing providers and options in Prince George's County. Returning citizens, families, partnering providers, and stakeholders are all welcome to attend. Lunch will be provided at noon, and remarks about the health department's re-entry housing program will begin at 1 p.m. This may be especially helpful for parents who work with justice-involved residents, housing navigation, partners, not parents. Partners who work with justice-involved residents, housing navigation, behavioral health, or social services. So please share amongst. And lastly, this is the save the date for the 2026 Walk to End Alzheimer's, which will take place on September 19th, 2026. Registration is now open and the link is included on the slide. This will be a great opportunity for individuals, families, organizations, and community partners to get involved, begin recruiting team members, and start fundraising efforts. With new treatments emerging and continued focus on brain health and prevention, this walk is another meaningful way to support awareness, research, and families impacted by Alzheimer's. So please feel free to share this within your networks as well. And with that, I'll turn it back over to you, Shanae.
Thanks, AJ. I was stuck on the very, very large kid zone for the Multicultural Festival. I just pictured a big bouncy house and I was like here for it. So don't judge me, please. Okay, this is the last call for Coalition Directory updates. If you have not already done so, please scan the QR code. We'll make sure this link goes out so you can update your contact information for the Coalition Directory. Again, I just want to make sure that we have everyone's accurate information, and we'll also utilize this as a way to ensure credit is given to everyone who participated in our CHIP development process. So please feel free to complete that. Are there any other partner announcements at this time? Let me go back here. Thanks, Timothy, judging me. All right, hearing no other announcements. I did mention earlier that we are not going to have our June monthly work group meeting. Instead, I am encouraging everyone to attend our full quarterly coalition meeting, where partners across every work group is going to be in attendance. So this is a great networking opportunity. It's a wonderful opportunity to hear updates from the health department, from the coalition as a whole, and to learn more about the work and the action plans from each work group and what they've been working on together to achieve this goal of making Prince George's County a healthier place. So the meeting will be on June 9th. That's Tuesday, June 9th from 6 to 7:30. It's in person. A hot meal will be provided to those who attend. So please register at the link on the slide, or you can scan the QR code. Registration is this Friday, or once we hit the capacity of 50 people, whichever comes first, and we are already pretty close to that. So if you are available and willing to attend, we welcome you. And then here is a quick snapshot of our remaining work group meetings. We have our Healthy Start meeting tomorrow, and then Healthy Connections is next week. And again, no June work group meetings, but please register for that quarterly meeting. And then as we close, we always want to say thank you, thank you, thank you for your continued partnership and engagement. We appreciate y'all being here today, and we look forward to seeing you at the June quarterly meeting. Have a great afternoon, everybody.
Thank you. You too.
Thank you, Shanae.
Thanks. Bye, friends.
And Shanae, my apologies. I really am so embarrassed that my mic was on.
Oh no, it's okay.
I'm the one who always am looking. I always cut it first, and I didn't do it. I was like, oh my God. Okay.
No, it's totally
Take care.
It happens. Have a
Yeah.
great one.
You too. Bye now.
Bye-bye. Right. Out. Hey, Roscoe. Go.